afternoon, everybody. My name is Scott McGann with the Falmouth Health Department doing our weekly COVID-19 update. Today's January 7th, 2022. And I think I got 2022 right, not 2021 on the slide, so I hope. FalmouthMA.gov is our website. Health@FalmouthMA.gov is our general email box, and 508-495-7485 is our phone number. And it's not been a good week. So from a case count-wise, 3,174 cases. These are PCR tests. I'll talk about home tests in a minute. There have been 353 confirmed PCR. Technically, it's more of this is more than a little bit more than a week, only because we did the FCTV on Thursday. So I took the case count, about 8 hours earlier than usual. So there might have been a few more on last week's. There should have been on last week's and a few less on this week, but it doesn't matter. It's a lot of cases, nonetheless. 99 probable cases over the last couple of weeks, about 100 of those. Our incidence rates jumped up to 96.6. So that's what our daily case count would be if we had 100,000 people population. So that's almost double. Our positivities jumped up to 12. So both in the high category. Previously we were at 8. So we have a lot of cases. I didn't have a chance to fix the chart and redo the chart. Someone does this for me, one of my board members. But anyway, the chart is, these last 3 weeks, just need to know it's gone over, way off the chart, more than double of what we had before. And again, these are PCRs, so they're not counting home kits. They never counted antigen. We always kept that separate. But it just, instead of saying what the number, the hard number, the number is probably I don't know how many test kits are being done. Let's say that somewhere around 500 cases, something of that nature. I don't know, because I do not know what the home tests are doing. We do have a couple people that report it to us, but by and large, the home kits are not known. These are just PCR tests. But comparing it, what it's really good for is to compare other weeks, where I blew out of the water any other previous time during the pandemic for total number of cases per week. This chart, the flatter and the tighter those dots, the better we are. You can see the biggest separation and the biggest jump has been over the last 3 weeks. Countywide, here's the green right in the middle where the spike is, about the same time last year. I put a question mark up top because, again, home kits are everywhere, so the number is some number way up near the question mark. But as far as PCR, the tests were for a 3-day total of 1,000 positive PCRs. Now, there is, it's not the same as 2021. So look at the green where you see teens of deaths over 3 days. And you're not seeing that. Now, it is a lagging indicator, but it's not inherently just sort of jumping up. It would be, if you're seeing 16 with a 3-day count of 400, 1,200, you'd see 3 times of that if it was the same. And the reason being, obviously, if all things being equal, the reason being is the vaccinations. And also, Omicron does appear to be on the less severe side from indicators, at least our call with DPH and the lead epidemiologist this week. So you're not seeing that. So it's not 2021 where, in these numbers of 12, 13, and 11, you might have one nursing home have 35 cases and 9 deaths, or 10, or some awful number like that. And that was really causing these jumps. You're not seeing that. Nursing homes are getting cases. They're either doing a better job, not only a better job, probably maybe getting it under control. They have more, knowledge under the belt. Also, the vaccine, the boost, is keeping these from getting out of hand. There is a bit of an increase, 4, 5, and 6, but not. It is a lagging indicator, but I don't foresee it jumping to 35 or 40, which if you did the numbers extrapolated it out from here, it'd be some number way really high. Hospitalizations. Again, case counts are relative. It's hard for me to give you accuracy on a case count with home tests. But hospitalizations and deaths are quantified, much more better easily quantified and easily to look at because they're more accurate. Falmouth Hospital was at 14 and 4. The 28th were 13 and 0. Hospitals increased, not at a rate. And let me show you what I did is I took 2021. I took this chart off of one of the previous times I did a COVID presentation last year, and you see in that sort of the 5th to the 19th, I'm circling it here with the cursor, 42 and 10, 35 and 18, 38 and 8. So the numbers, even though the cases are 3, 4, some factor higher, you're seeing hospitalization rates similar to last year. And it's going to be primarily among the young vaccinated. And so, that is the silver lining. The vaccines work in keeping you out of the hospital and keep you out of, really dire situation. Even though the case counts are similar, I would bet that going back up to here, of those 4, there's a handful that are not vaccinated out of that. So the hospitals are up, but again, they're not up proportionate to the amount of cases that are actually out there. It is spreading like wildfire. Look at the state, 25,000 cases in one day. Everything is much, much, much higher. Positivity, 22. I think that's definitely going to be the highest. You can see all the charts, the trends go up and up. But in purple, you don't see it going up at the same rate. So, again, cases are off the chart high. Omicron spreads. We'll talk about Omicron in a second. Seems much faster. Our incidence rate, everybody's up. We're sort of still in that, sort of mid-range at 96.6 cases per 100,000 per day. All of Massachusetts is 151, so we're better than average, better than the state average of 151. Still a lot of cases here, a lot of cases everywhere. Positivity, everybody's sort of bunched up in this sort of 10 to 15 range. The state's 15. Most towns in the county are between 10 and 14. But still, again, quite a bit high positivity rate. Again, this is only going to be on PCRs. Another silver lining, this reports, and I do this every week, COVID-19 cases in fully vaccinated individuals. This is the state. They provide this every week. 179,594 breakthrough cases since they started to track this, probably around September-ish. Probably since that's just the total number, but they decided to post this sometime around September. 3,909, or 2.18% hospitalization rate among cases of breakthrough. That number is about 1.5% lower, almost, right around 4% was that original number. So hospitalizations, at least from this chart, appear to be going down, the hospitalization rate among breakthrough. And 2 reasons I could think of would be boosters and Omicron causing less hospitalizations per case. Because this number, vaccines are waning, so you might have had your 2 shots, now 9 months ago. When they first did the chart, it might only have been 6 months ago. So you would think that would actually go up, all things being equal, because your vaccine's waning. So boosters have probably brought that down, and definitely Omicron's brought that down. This number here for deaths among the cases of 0.52, that's also a lower number. That was somewhere close to, I think, 7.5. So it's gone down about 25%. So this number's increasing. These 2 numbers are not increasing, and again, that's a good sign that vaccinations, are effective. Because it's more about hospitalizations and deaths than actually cases. Vaccination-wise, here in Falmouth, I added a couple of charts. The state started to give us boosters given. We had 495 first and second doses between the 22nd and 4th, so around the holidays. That's a pretty good number. We have 94% of all eligible residents have had 1 dose, so that's a lot, and 82% of residents are fully vaccinated. You can see that we've had some increases everywhere, mainly in the 5 to 11 because we've been doing clinics. The V&A in Barnstable County have been doing clinics at the schools and also the pediatricians' offices. So that group is the biggest group of increase. But you do see, among fully vaccinated, you see a 1% increase in a lot of the age groups. So that's a good sign. As far as boosters, 12,622 boosters. That's 40% of the entire population, not of those that have been vaccinated. If that's the entire population, that's the way the state gave it. Probably comes out to somewhere around a half or so have gotten boosters. I should do that math for next time. So 3,000 plus boosters in the 75 and older. So it looks like from 50 to 75, you see that the population of 75 is 4,548. In the second to the far left, you see that 45, 48 of them, 3,218 or 71% have received a booster. So I'd like to see that numbers keep going up, and so that's where we are with vaccinations. Vaccines itself, again, the pharmacies. We have a lot of pharmacies in Falmouth. Barnstable County Health Office does it once a week. Convenient MD has been doing it, as far as I know. I don't know if they kind of come and go with that. Community Health Center of Cape Cod, especially if you're a patient. Homebound, you call the health department, the 508-495-7485. We will have the VNA give you a call within a day or two to schedule that. So that if you're truly homebound, you can't leave the house, you need, or if you're a caregiver and you want to know how to get a vaccine or a booster, just call the health department. And the VNA and the Falmouth Health Department have a clinic at the Gus Canty. I put it on our website and did an email push. The senior center will send out a push today. That was 100 spots, and we still have 40 open. So it's been posted now for 5 days, and it's been 60% full. So we still had about 40. About an hour ago, I checked. It was at 40. There's still about 40 slots, give or take. So if you want one on the 19th at the Gus Canty, I believe it's 10 to 12. You can register. If you go to our website, the health department page, it'll be on there. You click that link, and that link takes you to the directly to the registration. Okay, so that would be for a booster clinic. Testing, a lot's changing with testing. Schools still doing the testing stay. It's been a real bear. It's been a real nightmare for the schools. That's a lot of labor right there to test. But they're trudging along, and God bless them. Convenient MD has always been a heavy hitter with testing, as is CVS's and the other pharmacies and other locations. Falmouth Hospital is looking to be expanded using some EMS services. When I have more information about the hospital expansion of testing, I'd like to see that relaxed with the whole going through my chart and all that, but I don't know. That's going to be up to the hospital, but I believe they're looking to expand hospital testing. The fairgrounds, you want to check with the Barnstable County Health and the Environment website. That does change. The community health center's done testing. Home kits is the big thing. I have a slide on home kits. And the state is doing a stop the spread. They're doing it. It's going to be free, and it's going to be at the Melody tent. They've posted Mondays 9 to 1, Tuesdays 1 to 6, and Wednesdays 9 to 1. That's free testing. It's at the Melody tent. Sort of one site to take care of the Cape, so it's going to be mid-Cape. So there's those opportunities for testing. Booster doses, again, you either go on vaxfinder.mass, 211 if you can't use a computer, there's an online, you can call that number there, and a state person would be able to do that. 12 and older now, okay? They're looking to move the 5 months to 6 months. I didn't see it in the guidance as of the time I wrote this. I know they are looking at going from 6 months down to 5 months. I'll update this chart next week. I'll update this slide when I get more information. Home kits. Falmouth wasn't chosen by the state to receive home kits. At this point in time, we don't have home kits available to hand out. I should have updated state, but let's say we'll allow the ordering directly from the kit manufacturers. That is something we just are on a Zoom call yesterday on that, so we did get the details. I should have fixed that slide. The main thing I want you to know about home kits is home kits are not contact traced. They're not going to show up in the case counts. If you go get a PCR, it will. If you go get a rapid from Convenient MD, where it's done by a proctor or someone doing it, that will show up in the system. We can, if you want guidance, you can let us know. I will hopefully by Monday. I'll put the guidance on, and make it simple. Try to simplify it a little bit and make it simple, like a chart that you can follow for visiting our website. Home kits are good. If they come back positive, you're definitely positive. Again, the key is if you get exposed and you test the next day, it may very well be negative because we usually want you to test 4 or 5 days into it. They say 5. So, home kits running out. I was out to dinner. Somebody called me. They started with symptoms that night. I ran out and got a test right away. It probably would be negative, but that doesn't mean you didn't get it because you tested too soon. So the home kits are good. You just, isolate yourself. Especially if you have symptoms, you'd want to isolate yourself if you're also feeling ill. So I'll put up the guidance on that, on the home kits. They're a great tool. It's just they're not necessarily going to get you're not going to get contact traced from us. You're not going to get a call, something like that, from the VNA to do contact tracing because again they're off the MAVM system, but they are good. I mean, if you're positive with it, you're positive with it. Follow up with a PCR if you want. We're not telling you have to do that because, again, it takes away somebody else's ability that doesn't have a home kit to get a PCR. But, again, home kits are around, that's it for that. So contact tracing, isolation and quarantine guidance. It used to be 10 days, it's 5 days now. If your symptoms are resolving after 5, you can leave your house, continue to wear a mask around others for 5 additional days if you're positive. If you're a quarantine situation, the only time that you would only need to wear a mask and not quarantine, previously you didn't have to quarantine if you were vaccinated. Now you have to have been boosted or had your series or J&J with the 6 months for J&J or Moderna. I mean, for Pfizer or Moderna and 2 months for J&J. You're considered fully vaccinated. You wear your mask around others for 10 days. Test on day 5 if possible. Again, the 5 days that's where the tests are going to be more accurate to show up. At any point, you develop symptoms, you need to stay home, okay? If you want you to stay home for 5 days if you've only been vaccinated but not boosted. So if you're unvaccinated, you have not been boosted, and your series is out of date, so to speak, not a great way of saying it, so it's been over 2 months or 6 months, stay at home for 5 days, continue to wear a mask for another 5. If you can't quarantine, you must wear a mask for 10 days. Test on day 5 again if possible. So the switch over from lessening the quarantine guidance, lessening the dates, also home kits, is putting the onus on you. It's much less the 2020 system of strict guidance, strict contact tracing. The state has lessened what our requirements are for contact tracing. It's just letting the case know what the rules are. It's not calling 5 other people to try to get them as contacts. So contact tracing, the guidance is lessening. So it's putting more of the onus on the individual. So I think that's where we are at this point. We're sort of, we don't want to call it yet for whatever reason. The state and some feds aren't calling it, but we're getting into more the endemic sort of phase of COVID, in my opinion, where we're going to learn to just trudge along with it. Omicron, this is very interesting. In orange is Delta. In purple is Omicron. So on 12/4, it was like 1%. Go to the next week, it's about 8% on 12/11. It jumps up to close to 40 on 12/18. By Christmas time, it was 75 to almost 80%. Now you're looking at over 90%. So what's happening now, this is all Omicron, which, could be, a sign that it's going, this is a variant that is more upper respiratory, more headache, sore throat, nasal issues, lesser of the lung, COVID pneumonia. That's why you're not seeing hospitalizations at the same rate. It just generally tends to be more upper respiratory, which is more cold-like, which, as this morphs over time, hopefully it becomes more of just another cold that floats around. That's what I think that's what they're hoping for. It definitely appears to be more transmissible. It does appear to have less severe outcomes. It's bearing out, at least when you look at that hospitalizations among vaccinated and boosted. Vaccines do work on this, especially if you're boosted. But you definitely see it indicating in the case counts, there's no doubt about that it is definitely more transmissible. And it's accounting for, virtually all. By next week, I would think it would be virtually all the cases, as opposed to, 95% of the cases. So, and the other thing about the cases, just also, let me go way back up to the beginning. One thing I have noticed, and hopefully it's a trend over the last couple days, I don't know if I put this slide on, but the last, on 1/3 and 1/4 of this week, the cases were like 65 and 84 daily PCR. The last couple days, it's been more like 22 or 23 cases. Hopefully that was a spike that's going to come down to more of that 20 or less cases per day, and not way up to where it was earlier in the week. So, hopefully that is, where we're going to be, going forward, but not sure. Face coverings, again, we're still at a mask advisory. Okay, schools are still requiring it at state level for those that are either unvaccinated or those that are going to be doing public transportation. The Board of Health on their 1/3/22 meetings this past Monday recommended that the Select Board adopt a mask requirement in town-owned properties, not a mask mandate for everybody. They want to, one of the reasons why this is, the Board of Health really, if they're going to do it, would do it for everybody. I don't think it makes sense that somebody's walking in one place and not the other. So the Board of Health looks at it more from, the entire population. So they didn't vote for a mask mandate over this past week, but they did vote to recommend that the Select Board adopt what they have under their control, which would be town-owned properties. So I'll present that to the Select Board on Monday. The Board of Health also urges that private businesses take a serious look at their business and consider also requiring masks at their places, but not mandating it. So they stopped short of a mandate, you know, and worked more towards, you know, having it. I think about half the towns have it in town-owned properties, but not in all public places indoors. I believe Wellfleet and P-Town are the only on the Cape right now that have a full mandate, but I could be wrong. I have not checked in a week or two, and things move fast. So I'll be presenting that to the Select Board on Monday, that the Board of Health recommends that the Select Board adopt it on properties that are town-owned, such as Town Hall, Senior Center, Rec Center, places of that. They did vote for that, but not for a full mandate, and so that's where we are with that. I do get a lot of calls about individuals who want mask mandates. And so that hopefully, if you're listening, I've answered your questions if I did not email you back. So right now, we're still in an advisory stage, and we may be still on Monday. It's up to the Select Board. Again, our incidence rates, going back to the metrics that we've been using, were both high, our incidence rates high. Our hospitalizations, I think we're hanging in there for the amount of total cases. These counts are similar to what we saw where we get. So 80 cases and 14 in the hospital, or, you know, a much higher hospitalization rate based on cases was occurring in 2021. Again, vaccines, the boosters, Omicron being, well, upper respiratory, less COVID pneumonias, what, you know, I've been hearing. Getting back to our vaccinations, again, it's always been strong. So as a recap, our case counts are definitely blown out of the water, and most likely the highest, and going to continue to be high for a little time. Hopefully, that couple of day trend that I happen to notice looking at the cases today is something that we're going to trend downward, and maybe this was the spike of it, but it could continue well into the winter at a very high rate. I wouldn't doubt for the next 6 weeks or so that it's continued to be elevated, just hopefully not 380 cases a week. 90% plus cases in the state are Omicron. Consider your vaccine status, your health conditions when you make decisions. We urge you to wear face coverings. It is not a mandate at this point. And just you have to consider your health when you make your individual decisions. Vaccine eligibility is anyone over 5. Boosters are now 12 and over. Our case data definitely still suggests that you're, you know, between 5 and 6 times more likely to get COVID if you're not vaccinated, and you're definitely 10 times plus more likely to get hospitalized and die. I personally don't understand why you wouldn't want one, but I'm not going to get into that with anybody. That's a choice. There's no consideration here at Falmouth at this point in time for any vaccine mandates. The Board of Health, some towns have tried to take that up with the Board of Health. I think Boston is the one that comes to mind that does have that. To go to places like restaurants and stuff, there hasn't even been any discussion of that here. Home kits are great. Just remember, if you're testing immediately after an exposure, it's probably going to be negative. You need to, unfortunately, let it incubate in you before it's going to show positive. And if it does show positive, it's definitely accurate. There is, a chance for false negative, especially if you tested too early. So you can always try to follow that up with a test done by a facility. There are going to be an increase in testing options soon with the state, and also here at the hospital. They're working on that as well. And the other thing I did want to mention is if this clinic does fill up that we did 100 doses on, we'll continue to do more. If there's not a demand for it, obviously we won't just keep doing clinics and have it unfilled. So if this clinic, maybe I didn't message it out that well, so if you're listening to me, you can jump on the website. By the time you hear me, it might be gone. If it's gone and you're frustrated and you haven't been, we'll do another one. If it fills, we'll do another one in a couple of weeks. We'll probably do a couple of months at least. But it's hard to tell. Sometimes you set the clinics up, but the pharmacies have easily been able to take care of that load or not. So the school, the VNA especially, is done with the rounds of schools. I'm sure they'll go back to it. So that frees them up. January, February. The flu clinics are over with them, so they do have more availability. So throughout January and February, if there's demand, we'll continue to run clinics. The rec center is probably the place we'll do it. Lots of activity at the senior center right now. So that's what we have for an update. Everybody just be safe. I'll do it again next week. Hopefully we are at a lower case count. And that's it for this week. Thank you.